PCOS is a metabolic syndrome. It's a complex metabolic syndrome, which means there's a lot of hormone imbalance in your body. And because of that, your ovary doesn't ovulate, right? So most of the female, they do Google and they come to me and they ask me what is PCOS and what is PCOD. So PCOD and PCOS are two different terminologies. PCOD is especially related to only ovaries. It's limited to ovaries, which is polycystic ovarian disease. In that, the ovaries are swollen and the ovaries start releasing immature eggs. PCOS is actually you have hormone imbalance, and because of which your ovary, which is a syndrome, your ovary start uh, making cyst. Like there is no ovulation. There are multiple cysts, multiple follicles growing up, but none of them are ready to ovulate. And this is what the PCOS is. The exact cause of PCOS is not known, but it's mostly genetic. Like if there is a metabolic disease going on in a family, or some physiological changes, like if you choose to have a sedentary lifestyle, if you are more towards obesity, then you might likely have PCOS. The first most important symptom of PCOS in especially in a menstruating female is the period cycle. Actually, the menses cycle, they are regular, uh, ideally ranging from 28 to 30 days or 32 days cycle in an average Indian female. But this cycle, it becomes irregular. Like females don't menstruate, they have a heavier periods, then you have a lower backache, you have acne, you have facial hair growth, there's loss of hair, some like strands of hair from a root, your hair are falling from a root, then it's more likely towards PCOS. If your disease or if your syndrome is like if you're not towards more of a obesity, if your symptoms are quite less, then we just give you symptomatic treatment. We correct your lifestyle, we advise you for exercise, we give you some healthy omega-3 fatty acids. And if like there is a severe hormone imbalance, so the correction actually needs hormone therapy. Fertility means what? You should ovulate. You should release an egg. Your ovary must ovulate. And in PCOS, there is no ovulation. So obviously, there won't be fertility. So it's not like it's not curable. You can cure it, but the span, like the treatment span, it will last for like 3 to 8 months. You should have that much patience in you. Like it's not like you come to me and you just do a magic thing and you'll get corrected. No, you should have some dedication. You should change your lifestyle. You should have a healthy diet. You should exercise regularly with a proper guidance of a gynecologist, a nutritionist, and proper medications. I always tell to my patients, like, your lifestyle works 50%, your medications work 20%, and the rest is doctor's advice, right? So lifestyle includes what? Like, what are the changes? Like, we are so busy nowadays, so what should be your lifestyle? You should always have fibers, high fiber diet. Like, you should add veggies and fruits in your diet. You should exercise regularly. Like, not I'm not telling you like you go and gym for an hours. No, just go take a walk and just have a stress free mind. You should practice meditation. Like nowadays we have such a hectic life, we don't get time, so just practice few minutes of meditation and that's okay. So you should change your lifestyle, and eventually it's not like a day process. Eventually you will land up with some really good results.